Perfect example of a PT party trick. It is very, very effective. This is like a Mulligan miracle kind of technique, as he would say. You can make a very rapid change. It's mostly, I'm sure, neurologic. Because the only other way you can make such a quick change in someone with such tight hamstrings is probably to rupture them. So the traction makes the biggest difference. Because if I were to just, so as a pre-measure, we'll just say, she doesn't really want me to push beyond here. And if I kept on pushing and pushing and pushing, it's not going to feel too good, right? So with the amount of traction you're putting into this, you're going to fire type 3 mechanoreceptors because you're taking the joint to its end range. Type 3 mechanoreceptors are going to inhibit the surrounding musculature. So some of the restriction is due to tone. I'm going to be able to take her past her barrier. The other reason why I think it works, because really Mulligan offers no theory other than just do it if it works and don't do it if it doesn't, is that you're providing such a big distraction that you're actually gapping this side lumbar spine. So if there are any adherent nerve roots, you're also going to improve the neural mobility of it. So the way this is done is you're going to grab above the malleoli again. You're going to squat, weight shift to start the traction. You're going to start lifting the patient up. I would recommend just lifting only with your legs. And then you eventually, after your legs straighten up all the way, which for me isn't very far, then I'm going to lift up, continue to lift up until the patient is well off the table. All right, so choose your partner / patient wisely. All right, all the way on the edge. So again, just to see, here's the baseline. Let's see the other one. Not as bad. And again, because this is probably a neurologic effect, the other one is also going to improve, which is tear up to this one, if it's going to work. You also want to abduct them and externally rotate them just a bit. You okay? Mm-hmm. Doesn't hurt, right? All right, so let's remeasure. Much better. Let's do one more for good measure. She's really light. There's some guy in Tuesday's lab who's like, I don't think anyone's going to be able to do this to me. I'm like, what do you have, an adamantium skeleton or something? You're just like an average guy. So much better. And is the other one better? Yeah, it's better. She has to keep on stretching. I would also recommend doing soft tissue work to the hamstrings just to make a more permanent change. If you don't keep on stretching, it'll probably last like 10 minutes. But you can make a very quick change with this technique.